My name is Dr. Nilay Kumar. I am an assistant professor in the Division of Hospital Medicine at the University of Wisconsin School of Medicine and Public Health in Madison, Wisconsin. I am delighted to present the results of our study entitled Seasonal and Geographic Patterns in Seeking Cardiovascular Health Information, an analysis of the online search trends. This paper is due to be published in the September 2018 issue of Mayo Clinic Proceedings. I'd like to thank our senior author, Dr. Chip Levy from the Ochsner Heart and Vascular Institute for his support and guidance with this paper. I'd also like to thank my co-authors, Dr. Ambrish Pandey from the Division of Cardiology at UT Southwestern in Dallas, Dr. Nitika Garg from the Division of Nephrology at the University of Wisconsin-Madison, and Dr. Emmanuel Champine from the Department of Biostatistics and Medical Informatics at the University of Wisconsin-Madison. To give you a little background, our study was inspired by several previous studies that have shown a significant seasonal variability in the incidence and mortality associated with cardiovascular disease. For example, sudden cardiac death, heart failure, acute myocardial infarction, as well as arrhythmias are known to have peaks of incidence during winter months compared with summer months. In addition to the seasonal variability, a robust body of work has shown significant geographical disparities in the mortality burden associated with cardiovascular disease. In the current era, vast amounts of data are generated as a result of everyday activities such as searching the internet or social media activity. We hypothesized that passively generated search query data with respect to cardiovascular disease would follow patterns, would follow seasonal as well as geographic patterns that were parallel to what has previously been observed in real-world data. So that is to say that we expected to find a higher search query volume on the internet with respect to cardiovascular disease in the winter months compared with summer months, and in areas with higher mortality burden from cardiovascular disease compared with areas with lower mortality burden from cardiovascular disease. In order to test these hypotheses, we obtained data from Google Trends. Google Trends is an online repository of search query data that is made publicly available by Google. Using popular search terms such as heart failure, heart attack, myocardial infarction, we obtained search query volumes for about 30 search terms for the US and Australia for the years of 2004 to 2014. In order to test for seasonality, we compared average search volumes for both countries by month as well as by season. Additionally, we performed a variant of linear regression known as cosigner analysis, by means of which a sinusoid is fit to a time series to test for seasonality in the data. Lastly, to test for whether regions with whether there was a correlation between geographical burden of mortality from cardiovascular disease and geographical search volumes, we performed an ecological correlational analysis where we tested the correlation between the mortality burden from CDC, from CVD as reported by the Centers for Disease Control, as well as the search query volumes obtained from Google. So in our study, we found that search query volumes related to cardiovascular disease were 15% higher in the winter compared with summer for the United States, and 45% higher for winter compared with summer in Australia. Now, when these data were analyzed by month, we found that within the United States, search volumes were 36% higher in February compared with August, and around 75% higher in August compared with January in Australia. When we performed cosigner analysis, we found that a sinusoid with a cycle length of 12 months fit the data with a p-value of less than 0.001, indicating a significant seasonal variation with a cycle length of 12 months. When we performed an ecological correlational analysis to test for the correlation between state-level search query volumes, and state-level mortality burden from cardiovascular disease, we found that these two quantities were positively correlated with a correlation coefficient of approximately 0.6 and a p-value of less than 0.001. So these findings may have several practical implications. This may include targeted dissemination of valid healthcare information by authoritative sources such as universities and professional societies. These data may also provide real-time insights into population-level interests and behaviors with respect to cardiovascular disease, which in turn may be associated with disease activity in the community. Future studies may examine whether search query data may be a useful means of augmenting disease surveillance for CVD at the community level.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.